Medtronic technologies impacted more than 72 million people in the last year, equating to 2 people every second. Harnessing the power of technology to take healthcare further, each technology has unique benefits designed to serve patients. The goal of this program is to get closer to the patient and to delve into the challenges and impact each technology has in practice. This is the Medtronic MedEd learning experience. The BIS monitoring system should not be used as the sole basis for diagnosis or therapy and is intended only as an adjunct in patient assessment. Reliance on BIS system alone for intraoperative anesthetic management is not recommended. Medtronic's medical education programs are offered to provide attendees education on the FDA-cleared indications and use of our products when applicable. The contents and conclusions of the following program are solely those of the speakers unless otherwise cited. The speakers are responsible for all content and any necessary permissions. The speakers received funding from Covidien LP, a Medtronic company, for the speaking engagement. For this segment of the series, a discussion on anesthesia in the brain, we will dive into the advantages of TIVA. To help provide insight into this topic is Dr. T.J. Gann, Professor of Anesthesiology and Distinguished Endowed Chair at Stony Brook University.
What is the role of total intravenous anesthesia in the enhanced recovery process? Well, there are many advantages of total intravenous anesthesia, although in this country it is practiced not quite as often as in some other countries, such as in Europe and other parts of Asia Pacific, where TIVA is a much more widely accepted. But if you look at the advantages of TIVA, they all have the benefits that we would want in an enhanced recovery program. So number one is certainly, environmentally, it doesn't have any exhaust anesthetic agent that we need to get rid of, so it's environmentally friendly. Propofol, as you know, has a significant anti-emetic effect. So if you are using total intravenous anesthesia as the induction and maintenance of anesthetic, you have a reduction in nausea and vomiting. It's almost equivalent to administration of one prophylactic antiemetics. It is also, in some studies, show that propofol is associated with less post-operative pain. Now, we know that propofol is a fairly fast onset and fast offset drug. So, if you want to have patients recover more clear-headed, propofol certainly fulfill that objective compared to inhalational agent. And now with propofol being generic, it is also price is really not the main hindrance or limitation of using the drug. So there are many advantages of using total intravenous anesthesia in enhanced recovery. Now, many society, including some of the professional society, recommends use of TIVA in enhanced recovery, such as this ERA society that was published in numerous publications. Okay, so now this study is an interesting one because there was some potential concern with in cancer surgery patients whether there was an increased risk of survival when we use different choice of anesthetic. So in this study, which is a retrospective study looking at over 7,000 breast cancer surgery patients, and they found really there was no difference whether you use an IV anesthetic such as propofol versus an inhalational anesthetic in terms of 5-year recurrence-free survival rate and mortality. So what is the impact of using brain monitoring, and in this case, bispectral index, to help us to guide our anesthetic with propofol? So first of all, if you were to give a patient propofol during induction, for example, and you monitor it with bispectral index, and you will find that this study shows that when the patients are awake versus the patient when they are asleep. So you can see a pretty clear demarcation line that above about 70, most of the patient will be awake, and anything that is below 70, almost all the patient will be asleep. So that gives you the level of confidence that if you are going to use brain monitoring such as bispectral index, that if you have let's say if I have a patient under anesthesia and I'm using bispectral index, if that number go above 70, I am concerned that the patient may have awareness. So I usually typically very quickly give a bolus of propofol, trying to bring the BIS level down to below 70, because statistically, if the BIS is below 70, the chance of awareness is extremely, extremely low. So you give you a level of confidence that you want to keep the anesthetic below the BIS of 70 if you are intending to be a general anesthetic.
Please tune in next week for a new segment from this series wherever you find your podcast. This is the Medtronic MedEd Learning Experience. Thank you for listening.